So my typical day usually depends on whether I've got any admitted patients or not. But so if I've got any admitted patients, my first port of call will be at GPH, community private hospital. So I make sure that the patients are sorted, and then from then I usually start seeing my outpatients from around 9 o'clock. And depending on when the bookings are, usually around up to about 4 or 5. So rheumatology is mostly a clinic-based specialty, so that's the nice thing where I hardly get inpatients. So most of my patients come in as cold cases, which I manage, and they go home. So that's a typical day where I spend morning until afternoon in the clinic managing patients. So rheumatology is a subspecialty in internal medicine. So after my post-undergrad studies, I went on to do my post-grad training, which was my master's in internal medicine. And that qualifies you as a specialist physician. But in internal medicine, there are different branches of medicine that we deal with, from cardiology, nephrology, as well as rheumatology, which I then chose to then go and subspecialize. So rheumatology is a branch where we deal with mostly all forms of arthritis, as well as rare diseases which we call connective tissue or autoimmune diseases. So it's a spectrum of more than 100 diseases that we manage as specialties, with specific insight into those diseases more in depth. So I graduated in 2005 at the University of Zimbabwe. So I've been working as a medical officer for a number of years until I went to self-specialize in 2016 as a physician, and then completed my subspecialty in 2023. So then briefly worked in Princess Marina Hospital for about 6 months, then opened up a practice. I've been running for a year now. So I think for me as a rheumatologist, which is now, I think the most challenging and the case that always pops into mind in terms of how much the disease can affect a person's life. I had a patient who was a young mother. She was a professional, a banker, high functioning, married with 3 kids. Unfortunately, she suffered from lupus, which is one of the connective tissue diseases that we have. And because it affects the whole body, she got neurological involvement. So she ended up with psychosis. And because of the neuropsychosis, she inadvertently murdered her 3 children. And we could see in terms of when the realization happened for what she had done and how it then affected her life, and even the marriage obviously fell apart. And this is a disease. It wasn't like as a mother would have killed her kids, but because of the disease and the implications of it, this is how her quality of life really changed. So as we speak, she's in a psychiatric facility where they are keeping her until they deem her safe, but still trying to manage the disease as well. So it's a challenge. That's something that's really, when I used to see her every time and to see the pain and how much the disease has actually, not on a physical, just on a physical, but everything that had happened in her life. She's unemployed, she lost her kids, she's no longer married, she's in a mental institution, she's got this chronic disease. So it just goes to show the impact of how the disease can actually affect an individual. For women, I think the challenge is always finding a balance, because you have to be the person who holds the home together. And when you have a career, you kind of always feel like there's more you should be doing or could be doing. And I think especially when you have to raise kids. And I think for me, the greatest challenge was when I went to specialize. It took 6 years for me to become a physician and a rheumatologist. And I had to leave my kids in Botswana and move to South Africa. And it was a tough balance in terms of the guilt of missing out and the impact it's going to have on the children, let alone the marriage, the challenges of distance and everything. But I think the thing that held us and helped us was my faith. With my husband, obviously support from him has kept things together. He managed to take over both roles and allowed me to pursue my career, so I'm always grateful for that. And I think it's always an issue of trying to explain it to the kids as well as you go through the journey, and try and see where they are and how they feel about it. And hopefully in the end, everyone comes out of the situation okay.
Oh,
So I think one of the things that's emerging in rheumatology is bedside ultrasound, musculoskeletal ultrasound. So it's a skill that we unfortunately didn't get trained during our training, but in terms of um, being able to train in that aspect and be able to do bedside ultrasound. So when a patient comes with a painful knee or shoulder, they don't have to now go on for the ultrasound, but I myself will be able to assess and do injections that are also ultrasound guided for more accuracy. So that's something I'm looking forward to probably getting in the future, as well as equipment. So that would mean obviously ultrasonography. And another thing would be to be able to do infusions once the drugs are available. So unfortunately, we're having an issue of registration of most of the drugs that we need in Botswana, and as a result, we're not able to give patients the best care. So we find that some drugs are not available locally, but once that we've met that hurdle, it would be good to also be able to have an infusion station where I can give my patients drugs and then they go home as day cases.
Doctor, thank you so much for the opportunity to meet.